our next speaker, who is Oliver Willows from Suffolk. We're going to be talking about effective strategies to deter and reduce instances of drink and drug driving. Okay, thank you. Oliver, over to you.
Thank you. Can you all hear me?
Yeah, we can hear you.
Perfect. Good afternoon and welcome to my presentation. My research project question is, what are the most effective strategies employed by police forces to deter and reduce drink and drug driving in order to improve road safety? Next slide, please. So what is the issue and why this topic? So drink and drug driving is increasing. Over 25% of UK road fatalities involve drivers with alcohol or drugs in their system. More people die on our roads than from murder and terrorism combined. I chose this topic because these offences pose a serious risk, and I've noticed a rise in drug-related instances in Suffolk, raising concerns that more people may be driving while impaired. The public would be surprised that not all officers can carry out these tests. I've been on response for 4 years and still haven't had the opportunity to receive this training. Next slide, please. So the results. So the graph shows data from the Government Department for Transport covering 2014 to 2022. During this period, drug driving offences increased by 114%, compared with a 23% rise in drink driving. Research also shows that male millennials account for most drink driving offences, while Gen Z make up the majority of drug driving offences. So millennials are in the age category between 29 and 44 years of age, and Gen Z is aged between 16 to 28. So why do I think this is? I feel like these two different generations have got a different perception on drugs. It's almost like comparing smoking to vaping. I'd see more millennials would be smoking, and more younger people, like Gen Zs, would be vaping. I see this as like a cultural shift. And also the deterrence theory, which suggests that increasing visible policing and roadside testing raises the perceived risk of being caught. It argues that people are less likely to offend when the potential punishment outweighs the benefits, and when the chance of being caught feels certain, severe, and swift. Next slide, please. So the road to safety. So I produced 4 recommendations. The first one being to expand the implementation and update the roadside preliminary drug testing equipment. So in Suffolk, we currently rely on the drug wipe 3S, which detects only cannabis and cocaine. This costs £17.39 per wipe. However, they no longer reflect the full picture of drug driving trends. National transport data shows the most common drugs involved in driving offences now include cocaine, cannabis, morphine, and ketamine. Studies also indicate a rise in amphetamine use, meaning our roadside testing must keep pace with these changing patterns. The manufacturer of the current 3S wipes already offers an upgraded drug wipe 6S, which can detect cocaine, cannabis, opiates, ketamine, amphetamine, and methamphetamine, though the cost is not yet known. Expanding access beyond specialist teams would also ease pressure on them, with response officers carrying wipes and receiving training to increase the testing opportunities. By increasing availability and ensuring more officers can conduct tests, we can expect more roadside tests, more positive drug identifications, more convictions, safer streets, and a stronger deterrent effect as word spreads among offenders. Next animation, please. Deterrent signage for drink and drug driving. So this recommendation promotes national deterrent signage based on the nudge theory, using small environmental cues to influence behaviour, such as drink and drug drive watch area, being displayed in pub and club car parks, which can act as situational reminders similar to the neighbourhood watch signs, which have shown to reduce offending. Additional cues like messages on bar runners and drink mats can raise the perceived risk of being caught and can offer ways to report impaired drivers. Campaigns such as Who's Taking You Home reinforces safer choices without using restrictive language like do not, which can trigger rebel psychological reactance, which is basically where they'll do the opposite. Implementation would be simple. Signage could be added to licensing conditions, and police communication teams could produce the materials and signs. Costs, however, unknown. However, the approach would be straightforward, scalable, and suitable for national use. Next slide, please. Here are some examples. The one at the bottom, the Who Will Be Taking You Home, is a campaign, and the top, some that I made earlier. Next slide, please. So continued recommendations. So the usage of alcohol interlocks. So an alcohol interlock is a breathalyzer device that stops a vehicle from starting if a driver has alcohol in their system. Alcohol interlocks offer a strong opportunity to reduce drink driving reoffending. Around 1 in 5 drink driving offences are committed by repeat offenders, and international evidence shows how effective this technology can be. In the Netherlands, drivers fitted with alcohol interlocks had recidivism rates 3 times lower than those who received standard penalties. Each device costs around £1,000. However, this is minimal compared to the 800 million the UK spends each year on drink driving incidences. Interlocks don't just prevent immediate offending, they help modify long-term behaviour, which is why several European countries already use them successfully. To implement this in the UK, legislation would need updating to make these devices mandatory. But courts could still choose to use them now and have offenders pay for them. This avoids public backlash and focuses on those most likely to repeat the behaviour. Next animation, please. We've got influential media campaigns targeting the demographic of drink and drug driving offenders. So there are annual drink and drug driving campaigns, but their impact could be strengthened by using social media influencers who reach the groups most likely to offend. Research shows people engage far more with influencers than with police accounts. So Instagram's largest UK user groups are millennials and Gen Z, which directly match the key demographic for these offences. Suffolk and Stanbury has around 26,000 Instagram followers, while an influence account such as Lad Bible, for instance, reaches around 15 million UK users. This matters because millennials are 115% more influenced by word of mouth than traditional advertising. If an influencer promotes a drink or drug drive message, it is far more likely to be shared and discussed. To make this effective, police media teams need to collaborate with influencers to create content that feels relevant, authentic, and impactful to those young audiences. Costs may vary, but if a campaign sparks conversation, it may even be shared organically at no cost. Next slide, please. So what does this mean for policing in practice? So more proactive roadside enforcement. We need to be proactive rather than reactive. More routine roadside checks, greater police visibility on the roads can lead to earlier intervention. Although this may initially increase demand for frontline officers, it can ultimately reduce the time spent dealing with road traffic collisions by preventing them in the first place. Prevention and visibility. When the public regularly sees officers conducting checks, signage in high-risk areas, and signage across venues and social media, the perceived likelihood of being caught increases. This could be applied in day-to-day policing easily whilst not utilising frontline resources. And also use of new technology and training. So updated drug testing equipment will lead to more prosecutions. This new technology would be at a cost, however training could be implemented in response training days. This also means the police stay aligned with emerging drug trends and evolving risks on the roads. Alcohol interlock strategies will target repeat offenders, lowering demand for police resources due to lower risk of RTCs. Next slide, please. So what research still needs to be done? So number one, primary research. So that would be vital for understanding local patterns, getting accurate costings, and measuring how well each strategy works in practice. This project relied on only secondary research because restrictions prevented sharing data from local policing systems with the public. Then we've got statistics. So more detailed statistics on drink and drug driving trends, reoffending rates, and the impact of current enforcement methods could be analysed. And also collaborate with other police forces. There is real value in collaborating with other police forces to share information, compare approaches, and build a clearer national picture of what works best. Next slide, please. So the conclusion, key takeaways. High visibility policing remains the strongest deterrent because it raises the perceived risk of being caught in line with the deterrence theory. Technology and proactive tactics strengthen deterrence. So modern drug testing wipes, alcohol interlocks, and targeted deterrent signage can close enforcement gaps and assist to reduce offending. And also, targeted communication reaches the highest risk groups. So influencer-led campaigns can strengthen prevention efforts and shift behaviour, while sharing information with pubs, clubs, and DVSA test centres offers a low-cost way to promote early intervention by placing onus on those on the front line. My recommendations are in line with the UK government's objectives to have stronger enforcement, public awareness campaigns, and targeting repeat offenders. My recommendations could significantly reduce and deter offences. Next slide, please. So 316 deaths caused by drink and drug driving. This demands decisive action. Act now, save lives. Thank you for listening.
Thank you, Oliver. Thank you so much. We've got a couple of questions in already. So we have one here that says, have you seen any good examples of social media campaigns on this already?
So there has been a couple from influencers such as like car channels and that I've seen on like YouTube. However, not any that have sort of distributed and widespread basically really far. So sort of the amount of distribution that we could possibly get, I haven't seen sort of actual proper ones which are being sort of shown from a police force towards these to actually have it targeted towards their audience. There's basically like car channels on like YouTube that have basically promoted it, but it hasn't been something that has been going on for long. It was just like a one-off occasion that I've seen, but no, not exactly.
Okay, thank you. And then here we've got a question asking, have Suffolk done anything with this yet? What sort of barriers have you found in uptake if it's not been progressed?
So not at this stage. So I presented this presentation to the Deputy Chief Constable and had discussions with my area commander around this. However, at this stage, the costs are the main issues. They basically, being the costs, I believe that could be combated through the recuperating these through the courts. So where a drug driver is prosecuted, this could be recuperated, the costs for this, as well as better officer training to help identify the need of a drug wipe, because I appreciate they can be costly, and also not necessarily every response officer in Suffolk or the UK would need to be trained in this, as long as there's some on a team, so we can provide sort of 24/7 coverage and also prioritisation to those officers who are the furthest away from the specialist resources, like the Rosenham policing team, because there's in some cases, some officers can be about, the nearest drug wipe could be about an hour away in Suffolk.
Okay, thank you. And then one last one here from Adam. He says, alcohol interlocks are a good avenue, however, easily bypassed by someone else taking the test for the subject instead of the subject itself. Do you know how common that is? And also, based on the costings of alcohol interlocks, do they disproportionately affect lower income offenders?
So, I mean, in relation to the bit by bypassing, for example, a passenger could basically take a sample. What I'd put to that passenger is, if you're in the passenger seat of the car and doing that for the driver, why is the passenger not driving? I appreciate they might have a driver's license or not know how to drive, however, they're then going to be putting themselves at risk. The alcohol interlock will basically ask for another specimen throughout the drive, sporadically. As well as that, for the recuperation of the costs, ultimately this is something that we could get the defendants to pay for to avoid that public backlash. However, in the case of which those offenders might not be able to pay for it, it might be a case that some of these costs or some different circumstances that might have to be provided for, because ultimately it's about preventing further instances and longer term modifying their behaviour. So I suppose every different circumstance will have to be taken into account.
Thank you so much, Oliver.